Welcome to Diabetes Day by Day, the American Diabetes Association's official podcast. I'm Dr. Neil Skolnik, professor of family and community medicine in the Sidney Kimmel Medical College of Thomas Jefferson University. And joining me, as always, is my co-host.
I'm Dr. Sarah Wettergreen, an assistant professor in the Department of Clinical Pharmacy at the University of Colorado Skaggs School of Pharmacy and Pharmaceutical Sciences. In this role, I practice as an ambulatory care clinical pharmacist at the UC Health Lone Tree Primary Care Clinic.
We cover a lot of different aspects of living with diabetes on this podcast, and this month we're going to do a deeper dive into the experience of living with type 1 diabetes. Now, in some ways, the experience of living with diabetes is similar for those with either type 1 or type 2 diabetes, but in other ways, that experience is very different.
That's right, Neil. To learn more about the experience of people living with type 1 diabetes, we have two wonderful guests joining us who are not only experts in the field of diabetes, but also live with type 1 diabetes themselves. First, I'd like to welcome Marina Chaparro, who is a nationally recognized bilingual registered dietitian, diabetes educator, and spokesperson. She is a certified diabetes care and education specialist and founder of NutriChicos, a bilingual nutrition practice specializing in children and family nutrition based in Miami, Florida. Welcome, Marina.
Such a pleasure to be here talking about what I love to talk about most, which is kids nutrition, but also sharing my personal experience living with type 1, but also being a clinician and diabetes care specialist. So delighted to be with you guys.
Wonderful. We're definitely excited to have you here. Next, I'd like to welcome my colleague, Dr. Sean Oser, who is a diabetes researcher and clinician. He is director of the Practice Innovation Program at the University of Colorado School of Medicine, associate director of the Primary Care Diabetes Lab, and an associate professor in the Department of Family Medicine. Welcome, Sean.
Thanks so much. I'm thrilled to be here.
Marina, my first question, I'd like to start by learning a bit more about your experience living with type 1 diabetes. Can you share a few details surrounding your diagnosis and how you found out you had type 1 diabetes?
So I love the way you started to say, there are similarities between, people with type 2, which we know is definitely much more common in type 1, but I'll be a little bit more controversial. And I'll say that living with type 1, I would say, is in a lot of ways very, very different. It's almost like a different diagnosis, especially if you're diagnosed when you're very early. It's one of those things that really marks the before and the after that you were living. And for me, it all really started when I was 16 years of age in the small border town of El Paso, Texas, and Ciudad Juarez. And, I had a different diagnosis in the sense that I didn't have, thankfully, a hospitalization requiring DKA or, a significant hospital event in that sense. It happened gradual because my pancreas was still producing, I would say, significant amount of insulin. So it started happening maybe a few months before, losing some of the weight, being really, really thirsty, just tired in general. And I remember it was a skiing trip that after the skiing trip, I was like, Mom, there's just something off. Like I can feel it. It's something off. And I woke up, I had conjunctivitis, and we just went to the doctor. And little did I know, blood sugars in the 400-500. And that is when the before and the after kind of happened. And, that marked a journey for me to, and little did I know, 20 plus years later, I would end up being where I am, a published author, helping kids, families just really thrive with not just diabetes, but have a healthy relationship with food from an early age.
Marina, can I ask you, because it's hard to even imagine how that must have felt at 16 years old to recognize that you have a serious chronic illness, and that must have changed the way that you view yourself. Is that correct?
Absolutely. Just and not just yourself, but your entire family. I always think that in type 1 diabetes, the kid is not just diagnosed with diabetes. The entire family lives with diabetes. And that is a huge shift in how the family operates, what they eat, how they eat, what they talk, the activities. So it really changes the entire family dynamics as well.
There's that term that it takes a village, right? We never go through things just ourselves. And the people who listen to our podcast are people with diabetes and also their families.
I always have this saying that diabetes success or successful diabetes management in type 1 is probably maybe 90% family related. And the rest may be, perseverance, personality, family situations, but really that family situation. And so what do I mean by that is how the family reacts to this condition, and a lot of it, unfortunately, there's a lot of things that the family cannot control. We're talking about like health status and socioeconomic, but also that support, that willingness to, okay, I don't know this, but let's learn together. So really that family support, how they view the condition. So are they seeing you as, oh my God, poor baby, you have a sickness? Or are they seeing you as, okay, sweetie, your pancreas is just a lazy pancreas. Let's just kind of learn with it and let's get you through this. And so I think that approach of what the family does, I think on an emotional and psychological level is sometimes we don't give it the importance it really, really needs in kids.
I so agree with you. One of my favorite quotes from any movie is from Rocky 2, where he says, life is going to throw things at you, but it's not about how hard you can hit. It's how much you can take and still keep moving forward. It's about how much you can take and still keep moving forward. And when I listen to your story, Marina, I am struck by how you took this diagnosis at the age of 16, when most of us are pretty vulnerable, and you've turned it into a source of strength, and now are a published author who has used your experience to help others.
And I mean, I think my mentality has always been a glass half full, and really taking what life gives me and using it to some type of advantage and to something greater. I mean, I don't know if that was just part of my DNA and kind of maybe my passion and my journey in this life. But I will say, having diabetes taught me a lot about resilience and what it means to live with something that has changed the way you used to live, but also looking at it as, we only have one life to live. How am I choosing to live this life? And I also love this quote that says, make diabetes your friend, not your enemy. So I think one of my roles as a clinician, as a diabetes educator, as a registered dietitian is to give people the tools to live a better life with whatever it is that they have, and really learn to cope and make diabetes their friend, because they will be accompanying. Diabetes will be my companion, hopefully until I am 99, God willing, but it needs to be my friend, and I need to learn to accept it, interact with it, have grace with myself. Otherwise, I'm not going to make it in this world as happy and as fulfilled as I am.
Marina, you are simply inspiring. Sarah?
Yeah, I completely agree. And I know that you not only live with diabetes yourself, but you also care for individuals who are facing the challenge of this new diagnosis and helping them to make diabetes their friend. What are a few key recommendations you might have for those individuals who might be facing this diagnosis recently, or might be parents of children who are recently diagnosed with type 1 diabetes?
I think this is just a really hard condition to first accept, because for many of us, we knew nothing or very little of. And so I think there's a lot of stigma associated with oh my God, will I be able to do this? Will I, can I do this? So there's a lot of, unfortunately, misunderstanding of this condition. So I think first is even allowing yourself almost the time to grieve and to really just say, this sucks. But also, once you do that, changing the page and seeing this exactly like I said, your kid has a lazy pancreas, you know? It's just he was kind of, it was a little defunct in the fabric and how it was created. But how can we just continue to move on and live the greatest life that you can with diabetes? And so I think that philosophy of, yeah, your son has a lazy pancreas. And when I say that to parents, they're like, oh, okay. Like sometimes the words chronic condition, it's an illness. It's like, I am sick. No, you're not sick. You just happen to have diabetes and you have a lazy pancreas. Let's learn what that
means to you and what we need to do, and take it from there.
That's a critical recommendation, is to find the mental space, and how do we think about this new diagnosis and even approaching it day to day. Are there any key nutrition tips you might have as well?
And I think, people listening might think that I would say, a typical recommendation is this carb or this protein, and, focusing on what a general registered dietitian would normally do. But I think my goal is to kind of go beyond that, and just personally living with a condition that is really tied to food. I am very careful to really treasure and preserve that relationship that we develop as kids with diabetes, because food is no longer just food, right? Food is measured. Food is given to you when you're low. Food is withheld at times when you're high. And so you develop a very complex and as I said before, like almost a militant relationship with food. So I'm always there to remind parents to remember to still enjoy food and find ways that kids can still enjoy food. And I'm not saying, candy bars or chocolate, what you would associate, but really allowing them to have a healthy relationship with all different types of food.
Marina, we have to have you on again to go into a deeper dive about how to do that. When I looked at your website right before this podcast, I was struck with your emphasis on joy. And I'm just going to read to people from your website. And you say the goal as parents is for kids not to just eat veggies, but rather, in big capital letters, you put like and enjoy veggies. And that idea of not moving through life with life as a burden, but rather facing it head on and enjoying what you do is such a critical. People with diabetes see a wide range of specialists, of people who give them advice on nutrition, both family and professionals. And it's important to listen to all that advice. But if the advice doesn't ring right to you, if it doesn't include that component of joy, maybe look for additional advice.
Amen. And I love the saying to say, that says joy is a nutrient. And I think, people with diabetes sometimes we have the restriction philosophy of you're not going to be able to do this, or this is going to affect you this. So it's always viewed in the negative terms. And I think we need to change that around to say, okay, let's not focus on what I need to remove from your life and from your diet, but what can we add? What nutrition can we add? But again, focusing on that joy, on that balance, on that positivity, because that is integral in health.
Now, Sean, based on our experience working together, I know that you are not only someone who lives with diabetes yourself, but you are the parent of a daughter who is also living with type 1 diabetes. To start, can you please share a little bit about your diagnosis and how you also found out about your daughter's diagnosis?
Sure, I'd be happy to. My diagnosis goes back to the week before I turned 18 years old, which was about 1,000 years ago. And I was overseas at the time, and I had been vaguely aware of some public service announcement I had seen that said, be careful out there of developing diabetes. And the top 10 symptoms of undiagnosed and untreated diabetes are excessive thirst and a bunch of other things that I didn't remember. And as the time went by, I started to feel like seemed to be pretty thirsty, and thought maybe I was just, I don't know, reading into what I had seen on this public service announcement. And to make a long story short, I wound up seeing a doctor. That I was in a farm settlement where they only had a doctor come like one afternoon every other week or something like that. So when they came around, they saw me. They tested my urine, and it had a lot of glucose in it, which I was told was not normal for a teenager, and that I needed to get seen in town right away. So I was on the next flight back to the U.S., and by that evening, I had my first dose of insulin, and I think I was really lucky. I never developed diabetic ketoacidosis or DKA. I was never hospitalized. I later learned that after excessive thirst came excessive urination and weight loss and other things, all of which I had had. And after that first dose of insulin, that first evening back in the States, I gained like 8 pounds overnight, which I realized was all just, I was so dehydrated from having had so much glucose that my body couldn't utilize, and from, urinating so much. But anyway, I feel like I was super lucky. Unfortunately, all of my friends were still overseas. This was like an end of high school trip. And I had literally none of my friends were back home as I was coping with this extremely life-changing brand new thing that I certainly didn't see coming. Had way too much time on my hands by myself on a long overseas flight, not knowing what diabetes was, just that I had it and something was waiting for me back home. So that's how it all started for me.
Sean, it must have been incredibly scary as an 18-year-old encountering this. And clearly, as we look back many years later, you've done incredibly well. In fact, this has become your life's mission, working with people with diabetes. Can you talk a little bit, because we heard from Marina about how important her family was to her and how how it helped her develop the resiliency and strength to move forward. How about for you? Where did your family fit into this?
Well, that was an interesting thing for me to explore, because this was literally like right before going to college that I was diagnosed. So my parents never had any part in helping me manage my diabetes, other than literally my parents met me at the airport, and my dad handed me a glucometer, and that I'm sure he hugged me first, but I don't remember that part. And it was like, I needed to be able to have someone to talk to. I needed to have, I feel like I'd always been very close with my parents. It was easy for me to call them and talk to them about whatever, to vent if that's what I needed, to ask questions for problem solving. I think that continued, except that a lot more of the problem solving was really just on my own. But fast forwarding to having been later through college, through medical school, through residency with 7-year-old twin daughters. My wife, who's also a family doctor like I am, we were very open with our kids, and I think I didn't make a big deal out of it as far as support or anything like that. My wife obviously was a great person to be able to turn to, not only for diabetes, but for anything else that I think I certainly like to think that we have and had a very healthy marriage, and that was just what, that's what spouses do for each other. But I was very, I didn't want to hide, right? So my kids, I'm sure maybe they thought that every dad took injections at dinner time and lunchtime and breakfast, if I bothered to eat breakfast. And maybe every dad sticks his finger to check his blood sugar, but multiple times a day. But it was still very jarring when one of our daughters developed diabetes. And again, it was the diagnosis story is always so interesting to me. We were going camping. We were on our way to go camping. I had finished clinic, I think, that afternoon, and Tamara finished a little bit later than I did, but I was getting the girls together and getting stuff packed in the minivan, and made sure that they each had a juice box, because once we started driving, we really didn't want to stop too soon. Jessica had first her juice box and then her sister's juice box. And I didn't really think that much of it, but they wanted to stop to go to the bathroom. So Tamara helped them to the bathroom, and she helped Courtney in the stall. And Jessica, when she came out of the stall, this is in the McDonald's bathroom. Jessica was gulping water out of the faucet of the bathroom sink. And I didn't know this, right? I was in the car, I was at the parking lot, but she came outside with both girls walking very briskly, and she said, "Check her blood sugar now." And again, we had checked their blood sugars a few times over the years when maybe we thought they were a little thirsty, or maybe they thought their diapers were a little too heavy or something like that. But the meter said, it just said high, right? Which I didn't remember with that meter, whether that means greater than 400 or 500 or 600, but it was greater than some multiple of hundreds. And of course, I didn't believe it at all. I thought it was wrong. And I checked my blood sugar, and it said something like, 162 or something for after dinner. Had Tamara check hers, and it said 82. Checked Jessica's again, and it was just high. So we got back in the car and went to the ER. And that was devastating and unexpected. And it was really then that I started to realize that I had had some difficult questions that I had asked over the years of my healthcare providers, that often they didn't know the answers to. And I thought that meant maybe they were poorly trained, or weren't listening, or who knows, but that they weren't what I needed, and I might move on to the next one. Only later did I realize, right, that we don't get taught this stuff in medical school, some of these questions that I had, and we don't learn this stuff in residency. And it's really lived experience that that you can only know if you've experienced it before personally, if you've, as a parent, as a caregiver, as a patient, and it really it changed where we look for support. And we really found that from other parents with children with diabetes, and then for me, from other adults with diabetes.
Sean, you used the term devastating and unexpected, and those feelings don't last just a day or a week. They continue to ripple out for a long time. When we think about our listeners who are somewhere in that first year or two of diagnosis, what are some things that you recommend that they can do at that point to turn the feeling of devastation and unexpectedness into a positive sense of being able to move forward?
Find someone else who's not in their first year or two after diagnosis. I think that the power of peer support is tremendous. It can be. It's not always positive, although I feel like it usually is. Just like you're not going to be friends with, nor do you want to be friends with, absolutely everyone you meet in life. And that would be true, I think, among people who have diabetes. None of us chose to have diabetes, but we all have to deal with it. And there's some people can be more helpful than others, and who those people tend to be. But when you find someone who you can either identify with, or who you can confide in, who can help you to see what things might look like a few years from now rather than just right now, I think that can be tremendously helpful. That ability, we tend to, we often, I think, as humans, we just tend to look ahead and think, well, I'm hopeless, or I'm devastated, or that was unexpected, I'm shocked, but seeing that if there's someone else who can show you that this is not an end, but maybe a beginning, and that there will be life with this and life after this, right, that can be inordinately helpful.
And Sean, I'm thinking about your experience with diagnosis compared to your daughter Jessica's, where you were somewhat alone, you were you didn't have the family support of people who have lived with this and can show you, I've had this for this many years. And even her experience of, she saw you injecting and checking your sugar growing up as a child, and that may have added some familiarity. But thinking of the support that you provided for her, what are some of the key messages or key points that you shared with her growing up as you have your lived experience and you're sharing that with her as a parent to support her through that process of living her best life with diabetes?
Yeah, one of the things that Tamara and I were always very deliberate about trying to do, and I credit Tamara for grounding me here. She's better at it than I am, but is making sure that that we make sure that Jessica knows that she's Jessica and that she's not diabetes. And it's been reinforced by other stories I've heard from other parents and other experiences that we've had. Basically, not to do things like, as soon as your kid gets off the bus and comes home from school, the first thing that you say when they come in the door probably should be something more like, "Hi, how was your day?" Not, "Hi, what's your blood sugar?" And as we want to know that, right? We worry about our loved ones, so we want to know that, but that doesn't need to be the first thing. And making sure that we reinforce their personhood and their personality first is super important. We also made sure to pay attention to our other daughter who doesn't have diabetes. Right, easy to forget about her, and Jessica definitely garnered more than her fair share of the attention, I think, because there was a whole lot more to do to take care of her, not just to parent her, right, but to be her helpers with her care for her diabetes. And Courtney doesn't deserve any less attention just because her sister has diabetes.
You're absolutely right. And something that really stands out to me, and you're bringing this thought to me, is thinking of how we've shifted language over the years. As clinicians, historically, people have used the term diabetic to describe an individual. And really now, as clinicians, we shift to saying things like a person who lives with diabetes. And while that can be part of your identity, it shouldn't be your sole identity. I have a student who's in my diabetes elective course at the School of Pharmacy where I teach right now, who we've talked about person first language, and she'll say, "I identify myself as a diabetic. Like, this is part of who I am. It's not the only thing about me, but it is part of who I am." So some of that can be nice to have, like, this camaraderie between people who have something similar to you, but remembering that you are a person first.
Yes.
This has really been wonderful. We only have a few minutes left, so I'd like to ask for some last thoughts. Marina, would you like to go first?
I mean, more than I'm saying, we need to have another podcast, because I think a lot of the mentality and a lot of the messages, and even like you said, healthcare providers, we're used to kind of prescribing in this way, don't have as much rice, or avoid the tortillas or the bread, but it's because maybe that's how we were trained. But I think now, living with that condition, when a clinician tells me, "Oh yeah, you can have chocolate, Marina, but you're going to have, a small piece, you're going to have it with strawberries, and this is the best way that you can do it," it's like, oh, and guess what? Because somebody tells me that, I might not have it every day, because I'm given the permission, or I'm taught, and I'm giving the tools that are allowing me to live a more realistic, a more flexible, and a more balanced life. And I think that is what success will be long term. It's not going to be a diet. It's not going to be the ketogenic or the low carb, because eventually people get tired because it doesn't fit with lifestyle. It doesn't bring joy.
That is a wonderful message to end on. And now, Sean, any final thoughts you'd like to share with our listeners?
Yeah, I think two. Number one, diabetes I definitely saw as a burden and a flaw and a liability when I was first diagnosed. And I as you mentioned earlier, Neil, it's really come to be my a lot of my mission in life is to help people with diabetes. So I hope that some good is coming of that in the work that I do and with patients, the research that Tamara and I do mostly together. But just more broadly, I think being able to use something that is not what you wanted, but to use it for good, I think is always a great opportunity. The second thing, and this is definitely something that we learned the hard way, is stick up for yourself and ask for what you want. And if you're told no, you deserve to understand why that is. You also can push back, and if you think it's right, you can still ask for it and still advocate for yourself. We were told no for something that we thought was absolutely right for Jessica, and we felt empowered to push back and ask. But not everybody knows that. Not everybody feels comfortable doing that. We weren't comfortable doing it either, but we pushed ourselves and we felt that it was the right thing. But it made me realize that, if I hadn't been there together with Tamara at that time, or if I also weren't a physician and if Tamara weren't a physician, that we might, if all of those things weren't true, we might have just said, oh, okay, I guess it's no then. And that's not always the right answer.
I love that as a message. Sean, it reminds me of one of my favorite quotes, and I believe it was from Theodore Herzl, who said, "If I am not for myself, who will be for me? But if I am only for myself, then what good am I?"
Yep.
And you really embody both of those things, which I think is a wonderful message to leave our audience with. Both Marina and Sean, this has been fantastic. Thank you so much for joining us.
Thanks for having me. I really have enjoyed it.
And to our audience, thank you. Tune in next month for the American Diabetes Association. I'm Dr. Neil Skolnik. Thanks for listening.